Hello friends, myself Professor Sanjay Prohit. I would like to extend a warm welcome to you on my YouTube channel. I would like to thank everyone who has subscribed my channel and encourage you to do so if you have not already subscribed it. Please subscribe it so that you will get a new video notification earliest. Friends, today we are going to talk about hematoma of the ear in dogs. Friends, in clinical procedure series, this is my 8th lecture. Oral hematoma. Oral hematoma is a condition where blood accumulates between the cartilage and skin of ear flap on the concave surface. This is known as ear hematoma or oral hematoma. Dogs with long pendulous ear may be more at the risk for the oral hematoma. This condition is common with chronic otitis externa. This may be unilateral in one ear or may be bilateral in both ears. This may be complete or partial. Complete when whole pinna are involved. Partial when a small portion of pinna involved in hematoma. This condition is painful. Now we discuss about etiology. Friends, itching and discomfort leading to head shaking or scratching that cause trauma which can rupture the blood vessels in the ear flap and cause hematoma formation. This is associated with ear infection, allergy conditions, parasites that are present in the external ear, that are ear mites and ticks, or may be due to fly bite on the tips of the ear. This may associated with the foreign bodies like the grass seeds and other foreign materials that are present in the external ear. Ear hematoma is also associated with the increased capillary fragility. Diastoma is main cause of the oral hematoma formations. This is maybe due to bite or accident, or may be associated with excessive shaking or scratching of the ear that cause the trauma and rupture of the blood vessels, and finally formation of the hematoma. See this picture. This is the ear pinna, this one, and this one is the concave surface. This is the outer surface, convex surface. When there is any trauma, there is rupture of the blood vessels and formation of the hematoma between the skin on the concave surface, means inner surface, and this one is cartilage. Friends, hematoma is not life-threatening condition. However, if left untreated or inadequately managed, it may be very painful process for the pets and result in chronic thickening and fibrosis, leading to irreparable deformation of the ear pinna. Now we discuss about some points of anatomy of the pinna. Friends, ear pinna receives blood from the great auricular arteries and blood return through the auricular veins. The main blood vessels are located along the convex surface, means outer surface. These are, and small branches pass through the cartilage to supply the concave surface. Ear's sensory innervation is supplied by the second cervical nerve on the convex surface and trigeminal nerves oculotemporal branch on the concave surface, means inner surface. Vessels run parallel to the long axis of the ear. In this direction. Now we discuss about symptoms of oral hematoma. There is swelling of the ear flap on the concave inner surface of the pinna. Swelling may involve entire pinna or it may involve only one area of the ear, means this may be the complete or partial. Swelling is soft, spongy, fluid-like and warm at early stage. See this picture. With time, the scar tissue will thicken and deform the ear. Shaking of the head or scratching at the ear or tilting of head sideways. Possible underlying sign of an ear infection such as redness, discharge and other are also present. Balloon-like appearance of the ear. Ear dropping lower than the usual. Redness as well as pain and sensitivity in the affected ear. Now we discuss about diagnosis. Friends, the diagnosis of oral hematoma is very simple. This is diagnosed based on the history and physical examinations. History. In the history, there may be history of the trauma, there may be history of the chronic otitis. Physical examination revealed swelling of the ear flap. Palpate the area to assess the fluid presence on the concave surface as well as consistency of the swelling. On the basis of this, we diagnose the oral hematoma. Friends, now we discuss about the treatment aspects. Treatment of underlying disease of the ear are crucial to minimize the chance of hematoma recurrence. There are two treatment options are available. First one is conservative, second one is surgical. Conservative treatments are applicable or useful in case of the very small size hematoma that are not causing any significant discomfort, allowing the body to reabsorb the blood, monitoring and managing the underlying causes, administer the anti-inflammatory, analgesic and antibiotic drugs, and proper bandaging. This causes some relief or cure the very small size oral hematoma. When the hematoma are large size or where the conservative therapy are not useful or successful, then we shift on the surgical treatment. Friends, the objective of surgical treatments are remove the hematoma, establish the drainage, prevent the recurrence by placing the tissues in a position, retain the pinna's normal appearance by minimizing the scar formation. Friends, 4 surgical techniques are commonly used to treat the oral hematoma. First one is incisional technique, second one punch biopsy technique, laser technique and drain technique. We will discuss one by one. For these surgical techniques, first we have to anesthetize the patient. For the dogs, we use atropine, xylazine and ketamine combinations. Atropine at dose rate of 0.4 mg per kg intramuscularly. Then after 10 minutes, we inject xylazine at the dose rate of the 1 mg per kg intramuscularly. After 10 minutes, we inject ketamine at 5 mg per kg intramuscularly. After that, we maintain the patients on isoflurane gaseous anesthesia as per the need. Friends, you can opt any anesthetic combinations as per your expertise as well as the facilities available at your hospital. After anesthesia, we control the animal in lateral recumbency, keeping the affected ear upward. Now we comes on the incisional technique. Best results are obtained if surgery is performed 10 to 14 days after formation of the hematoma. Prepare entire pinna on both sides for aseptic surgery. Ear canal should be properly plugged with cotton prior to surgery. Then S-shape incision. S-shape incision is made over the length of hematoma on the pinna's concave surface. Likewise, like this. Make the incision from the hematoma's distal end to proximal end in this way. Incision should only include the skin. The cartilage should not be incised. Only skin should be incised. Drain the blood and remove the fibrin clot from the hematoma cavity using a moist gauze sponge or mosquito forceps. Use sterile saline to flush the cavity. Friends, interrupted mattress suture are placed parallel to skin incision by using non-absorbable monofilament suture material, size 10 or 20 on a straight cutting needle. Suture should be placed parallel to the vessels located on the convex surface of the ear, means outer surface of the ear, making sure to avoid penetrating the vessels with the needle. Suture should be tightened only enough to allow a position of the skin and cartilage. See, suture should be placed parallel to incision or parallel to blood vessels like this. This is right methods and this is wrong method. So you should adopt the right patterns, right methods of the suturing and avoid the wrong method. In case of the large hematoma, 2 to 3 rows of sutures 5 to 10 mm in width and 5 to 10 mm apart in each row and parallel to incision and major blood vessels are placed like this. One row, another row, another row and another row like this. This reduces likelihood of ligating the major blood vessels. Place enough suture to eliminate the dead space between the skin on the concave surface and auricular cartilage, so blood cannot no longer accumulate at the hematoma site. Leave a slight gap 2 to 4 mm in skin edges of the incision to allow continued drainage. This one for continued drainage. Sutures are placed such that the knots are located on the convex surface, outer surface of the pinna. Bandage of the ear over the top of the head. See these pictures. This is the S-shape incision placed on the inner surface of the ear, concave surface of the ear, and remove the blood clot and fibrin. Then place the sutures parallel to the incision. We can place in 2 row, 3 row, 4 row as per the need, and note should be placed on the convex surface, means outer surface of ear. For better result, we can use quill suture or we can use button suture like this. Friends, now we discuss about punch biopsy technique. Friends, make 1 to 2 centimeter transverse incision on the distal and proximal edge of the hematoma to drain the fluid and remove the fibrin. Then use 4 to 6 mm skin biopsy punch to make several drainage holes in the skin on the concave aspect of the pinna, like this. This is skin biopsy punch. Remove the skin only, leaving the cartilage intact. To prevent the punch from penetrating the cartilage, insert a sterile flat instrument through the distal incision to hold the skin away from the cartilage. Drainage hole should be evenly distributed across the entire hematoma, approximately 10 to 15 mm apart. Leave these drainage sites open to heal by second intention, but the peripheral edge down to the cartilage using the simple interpreted suture patterns. See this picture. This is the skin and cartilage cross section of the ear. We put the incision on proximals and distal aspects. Then using the punch, we made the several holes on the hematoma, only on the skin. Then suture the skin with cartilage, or we can go through and through suture using this and tie on the inner surface, means concave surface of the ear. See the needle directions in the suturing. These sutures are placed through the skin on the concave surface and cartilage only, or full thickness through the pinna using 10 or 20 monofilament suture material, like this. The suture should be placed parallel to the blood vessels without tension to avoid damaging the blood vessels. The ear is bandaged over the dorsum of the head until the circular defects heal via second intention. Friends, now we discuss about laser technique. Use a CO2 laser to make 1 cm incision in the skin for drainage and lavage. Then make multiple 1 to 2 mm skin incision over entire hematoma that extends slightly beyond the edge of the hematoma, or make small 4 to 6 mm holes can be made over the hematoma, similar to punch biopsy technique. Means put 1 incision, then we can make several incision over the hematoma, or we can, after the drainage, we can make several small holes like the punch biopsy technique using the CO2 laser. These open lesion provide drainage while stimulating the tissues to adhere, and suturing is usually not necessary. Ear is bandaged over the dorsum of the head for few days until the wound heals by second intention. Like this. Cosmetic results after carbon dioxide laser surgery for oral hematoma are encouraging. Friends, now we discuss about drainage technique. It is typically used when the hematoma is small or when surgery is not an option. Drainage techniques are associated with higher recurrence rate and client dissatisfaction. So this is only used in case where the hematoma is very small size or when surgery is not an option. Make the small incision in the distal and proximal aspect of the pinna's concave surface overlying the hematoma. Aspiration, draining the fluid from the hematoma with the needle may be helpful. Drain the hematoma, remove the fibrin clots and lavage the cavity with sterile saline solution. Fenestrated Penrose drain or tip cannula is inserted. Cannulas are heavier than the drain tubing and they are more prone to accidental removal by the pads. Put the drain through one of the stab incision and into the cavity. Then pull the drain to its exit through the second stab incision. Suture the drain ends to the skin at the distal as well as proximal incision site. The ear should be bandaged over the head for 5 to 7 days. Remove the drain in 5 to 7 days. Friends, now we discuss about bandaging in case of the oral hematoma. After the operation, we should protect the surgical site from infection and trauma, either by shaking their heads or trying to scratch the site. It is important to avoid the incorporating the normal ear in the bandage. It is best to leave the hematoma site and ear canal opening exposed, like this. The standard techniques for the bandage: for this, cutting 4 pieces of white cotton tape to tape 6-inch pieces and 2 18-inch pieces. Depending on size of the head, more tape may be needed. Cut the strip of the cotton tape. Two strips of 6-inch and rest 2 strips are 18-inch in length. Then, starting at the base of the pinna, place the short tape on mid and lateral margin of the convex surface of pinna, means outer surface. Outer surface. Position the longer strip edges of the tape on the concave surface of the pinna, so they contact the tape on the convex surface. This allows the pinna to be sandwiched between the tape and creating a secure environment, like this. Place the roll of the gauze or bundle of roll cotton on the top of the pet's head and lay the affected ear over the top of the gauze or roll cotton. Bring the strip of the tape around the head and neck so they terminate just ventral to ear canal of the affected ear, like this. Trim any excess tape so it does not cover the ear canal. Apply cast padding or roll of gauze loosely around the pet's head, enveloping the tape stands to keep the ear in place. Finish the bandaging by loosely applying the flexible wrap and an external layer of the cohesive bandage. Other ear is not enclosed in the wrap. Bandage should be checked periodically. Insert at least 2 fingers under the bandage comfortably. It is likely not too tight. Owner should also check the bandage at least twice daily to ensure it remains loose. It remains loose or it not soiled. Bandage should be changed even it get soiled or at least every 3 days. Bandaging should continue until the granulation tissues are present at the surgical site, drainage is minimal and patient is no longer shaking his head. Elizabethan collars are used at all time until the incision has completely healed. Now we discuss about post-operative care. Friends, it is crucial for ensuring the successful outcome and preventing complications. Patients may also need tranquilizers to keep them calm and help them to tolerate the bandage and Elizabeth collar. For post-operative care, we should use e-collar, proper bandaging. We should give the analgesic, antibiotic and antiseptic dressing. There are some complications in this case. There may be infections, there may be recurrence of the oral hematoma, there may be deformity of the ear, there may be scar tissue formation, there may be the pinna damage or necrosis. These are some common complications of oral hematoma. Now we discuss about preventing the oral hematoma. How we prevent the oral hematoma? Friends, recurrence is possible, particularly if the underlying causes are not adequately managed. So we should monitor the pet, regular ear cleaning, managing the allergy conditions, parasite control, and careful grooming. Friends, on the basis of today's lecture, we design some questions for you. You are requested to solve these questions. At the end of this video, the answer of these questions are also provided. Question number 1. Which diagnostic method or technique is commonly used to confirm an oral hematoma? A. X-ray. B. Ultrasound. C. Physical examination. D. MRI. Question number 2. Which anatomical structure is primarily involved in an oral hematoma? A. Tympanic membrane. B. Pinna. C. Cochlea. D. Auditory ossicles. Question number 3. In case of chronic oral hematoma, what change might be observed in the cartilage of the ear flap? A. Thinning and brittleness. B. Calcification and fibrosis. C. Increased elasticity. D. Erosion of cartilage. Question number 4. What is the common long-term sequel of untreated or inadequately treated oral hematomas? A. Progressive hearing loss due to tympanic membrane rupture. B. Fibrosis leading to thickened, crumpled ear flap. C. Development of malignant tumor. D. Total ear canal ablation. Question number 5. Breed with what type of ear structures are generally at higher risk for oral hematoma? A. Erect pointed ears. B. Long pendulous ears. C. Short upright ears. D. Small triangular ears. Now this is answer time. Please check your answer yourself. Question number 1. Option C. Question number 2. Option B. Question number 3. Option B. Question number 4. Option B. And last question, question number 5. Option B. Thanks for watching this video. If you have any doubts, please see this video again and again. If you have any further doubts or have some queries, just comments me, I will reply.